Hi everyone, welcome to our follow-up session for the catch-up vaccinations with Anne Allen. I would like to start by acknowledging the traditional owners of the land across which we work and pay our respect to elders past, present and emerging. Sovereignty has never been ceded, it always has and always will be Aboriginal land. I also extend that respect to any Aboriginal colleagues who may be joining us today. Today we're joined by Anne Allen again. Thank you for attending this follow-up session. Please note that you can use the chat function at the bottom of the screen, or if you wish, please come off mute and ask your questions verbally. It is a smaller group today. There's only about 10 of us in here, so it's a safe environment to ask whatever questions you need to. Other than that, oh yes, we hope you've brought with you your catch-up sessions that you've had a go at working out, and Anne is here to answer any questions and help you with making sure you've got the right catch-up worked out. So yeah, welcome Anne.
Thank you. Okay. Oh, hang on. Okay, so we'll start off with any questions from any of you. Please, if you've got any questions from any of the catch-ups or just generally about catch-ups, did you want to ask now?
I have a question. It actually happened only recently. So I had the child came from overseas. It's just like when we try to, because the parents insist she had the chicken pox when she was a kid, and they would not let us give her the varicella booster, but they can't prove any documents to say like the kids is actually, you know, which is fair enough, because who will ever, you know, have the clinical notes saved, just say 10 downs in the track, we can show somebody else my kid had the chicken pox. So yeah, what should we do in this situation?
So the child needs to have serology, chicken pox, and then if it comes back as immune, then the doctor has to fill in the immunisation from Services Australia, the medical exemption form. There's a section in that they fill in saying that they're immune, and then they have to send that off to the Australian Immunisation Register. And if they're going to childcare, they have to give a copy of that to the childcare. Hopefully it'll come up on air that they don't need vaccination. So they do need to have serology.
Yeah, okay. Thank you.
So sometimes it's just better to give a vaccine rather than take blood.
Yeah, just our doctor's very reluctant to do serology for children. I mean, that kid is 10 years old, which is not too young, which is fine. But some kids, let's say they're 5 years old, it's almost impossible.
Yeah, but it would be harder to take blood than give an injection, wouldn't
it?
Yeah. I guess that's the point here, that the message you got to try and send home to the parents too is that, you know, you understand that this child might have had chickenpox before, but it's not a contraindication to receiving the vaccine, and therefore you should just vaccinate again instead of doing serology.
Yeah, that's what we're trying to push, you know.
If
serology came back negative, we still need the, you know, one more needle anyway. But
yeah, that's right.
It's many the parents, they say, oh, she had an infection before. No, we don't need that. So couldn't move anyway past that. But that's okay. I'll try my best. I'll try again with them.
It will affect their funding, their tax funding, and the childcare. I mean, sorry, this child's older than childcare. Did you say 10-year-old?
10, yeah. So they need that for school as well.
Well, then the school cannot stop them from going to school if they're not vaccinated. But also now that they're over 10, they're going to need 2 injections 1 month apart. One injection is not enough for this child.
Yeah. Oh, yeah, that's right.
So yeah, but yeah, to ensure that they get their funding, they still need to prove that they are immune.
Yep.
Okay.
Yeah. All right. Thank you.
So, Anne, we also have a question in the chat from Leanne, re-health worker. If no documented evidence of 3 Hep Bs, but serology will show strong immunity around 1,000, will New South Wales Health accept this, or do we always need documentation of 3 doses?
I think they have to show 3 doses. Yeah, I'd have to check that on the policy directive.
Yep. Yeah, it'd probably be in the details of the policy directive.
Yeah, I've got it here. Go down to Hep B. Yes. Okay, so this is the evidence for hepatitis B. So hepatitis B vaccination declarations are acceptable for all attempt failed to obtain the vaccination records. The assessor must be satisfied. Okay, so they do need a history of age-appropriate hepatitis B vaccination in accordance with the Australian Immunisation Handbook. So when we were giving the hepatitis B at school back in 2007, 2008, we were only giving 2 adult doses 4 to 6 months apart, and that is an acceptable course of hepatitis B. You only needed the 2 of adult. So that's accepted. Otherwise, it's 3 doses. Under 20 years, it's pediatric. Over 20 years, it's adult. And then they need to have serology. Oh, no evidence. Yeah, it doesn't say if they haven't got the... I'll find out and let Leanne know.
Great, thanks. Just, this is Leanne's written, how long after 3rd Hep B do we do serology?
6 to 8 weeks.
Great.
It's Leanne Fuller, wasn't it?
Yes.
Okay.
Another question, with the due dates of vaccines, e.g. the 18 months, how early can you give a vaccine for it to be accepted on air?
For the 18-month ones?
Yeah, this one's for example, but I think it's more generally all the vaccines. But if you can comment on the 18-month one first and then the others.
Okay, so the 18-month one, the Infinrix or Tripacell must be 6 months between the 6-month Infinrix Hexa and that 18-month Infinrix or Tripacell. So usually that's not a problem. That's the minimum. They do prefer it closer to 18 months though.
I think for AIR to accept it, it won't be accepted before 18 months though.
Yeah, they do. They do. Okay. The MMR-V, so the measles, mumps, rubella and chickenpox, must be 1 month since the MMR at 12 months. So you can give the MMR-V 1 month later after the 12-month one. If it's for like an outbreak of chickenpox, there must be a minimum of a month though, but they do prefer it from 18 months. And the HIB, ACT-HIB, I'm not too sure when that's accepted. I think that is at 18 months.
Yeah, so the AIR don't release any details on, at what date they accept things early, because I don't think they want it to be well known. I think they want you to follow the schedule, except for in those extenuating circumstances. And, if you need to give a vaccine for whatever reason, going overseas, etc., outbreaks, give as needed, but it might not be accepted by AIR and you might have to revaccinate at that scheduled time point.
Yeah. So the 6-week cannot be given before 6 weeks. The 4-month can be given early, especially if the first vaccines were given at 6 weeks. But there must be a completed 2 months between the 6-week and the 4-month vaccines. So there's usually 2 weeks, that you can give it a bit earlier. And that's usually for travel. There needs to be a good reason for it to be given early. But the 6 months, the 6 months should not be given early because the hepatitis B component of it needs that maturity of 6 months. So yeah, not the 6 month. The 12-month can be given from 11 months, but not a day before. They will not accept it a day before 11 months. And the 4 years, they do prefer to be 4 years. They need that maturity, but they will accept it from 3.5 for, you know, maybe for travel or something. But yeah, preferably for 4 years, because then they don't have another injection till they're in high school.
Yep. And just for the question earlier from Yiwei, I've just added in there the link again for the No Jab, No Pay. So that's probably another resource that you can show the parents to say, you know, if you want to keep receiving child benefits, it's up until the age of 20 for the kids. So they need to have, you know, that evidence of vaccination. Just another ammunition resource for you.
Yep.
All right, if there's no more questions for now, we'll get into the first catch up.
Okay. So this little boy is 18 months. What do I call him? John Smith. He identifies as Aboriginal. He's had 6 weeks and 6-month vaccines, and that's all. So this is my working out. Okay, so for the DTP, for his age, he needs 4. At 18 months, he needs 4 doses of DTP, but he's only had 2, so he needs a 3rd dose now. And you'd need to give it as Infinrix Hexa. Okay, so dose 4 is 6 months later after dose 3. And you give that as DTP, like as Infinrix or Tripicel. And dose 5 at 4 years, or at least 6 months after dose 4, whichever is later. That's DTPA and IPV. Is there any questions about the DTP? No. Polio goes with the DTP. He needs 3 doses and he's up to his 3rd dose. But the 4th dose of DTP IPV will be given at dose 5 at 4 years or 6 months after dose 4 DTP. Is that confusing? He is getting a 4th dose, although he only needs 3. Yeah. Hepatitis B, he's had 2 doses. Now for hepatitis B, if they're born overseas, they will accept the birth dose of hepatitis B, but if they're born in Australia, they will not accept the birth dose of hepatitis B. So in Australia, the birth dose is dose 0, and or just the birth dose, and then dose 1 is at 6 weeks, and then he's had dose 2 at 6 months. He needs 3 doses, and he's going to get his 3rd dose as the 4th dose of Infinrix Hexa, or the 3rd dose of Infinrix Hexa. Yeah. HIB. So you go to the table in the immunisation handbook, to the HIB table, and that will tell you for his age and how many doses he's had previously, how many doses he needs. He only needs 1 more dose, and that he's getting that with the Infinrix Hexa. He doesn't need any more pneumococcal 13. Oh no, sorry, he does need 1 more dose of the Prevnar 13. And this again was from the table, the Prevnar 13, in the catch-up section of the immunisation handbook. And that's all he needs, just 1 more dose of the Prevnar 13. He needs a dose of the Nimenrix, or the meningococcal ACWY. Oops, sorry. The MMR, he hasn't had any doses, so he needs 2. and they're 1 month apart. So he has a MMR now, or you can give the MMRV now. Oh, no, sorry. Don't give the MMRV. Give the MMR now, and then a month later, MMRV. He's too old for the rotavirus. He's already had 1 dose. That's better than none. But yeah, he doesn't get any of those. The varicella, he's getting a dose with the MMRV 1 month after the MMR. And then meningococcal, because he's a Aboriginal kitty, he can have 2 doses of Bexero, and they're 8 weeks apart. He needs to have started it before he turns 2 to get it for free. So all Aboriginal children under 2 get it for free. Influenza, all Aboriginal children and adults get influenza vaccine for free. This is the first time he's had it, so he needs 2 doses, 1 month apart. And we encourage him to have a second dose of varicella 1 month after the MMRV. But it is not for free, and his parents need to pay for it via a script if they will. Any questions about Johnny?
There is one in the chat. Or not Johnny specifically, but babies, if they come in for 12-month vaccinations and they've missed their 6-month vaccinations, can they have them all on the one day?
Yeah, so there's only 1 vaccine at 6 months. So you give that with the 12-month vaccines. You're not doubling up on anything, and just give it all together and he's up to date.
Yeah, excellent. Any other questions?
Yep.
Just a quick one. As long as they start the Bexero before 2 years, the second dose is free too?
Yes.
Yes.
Yeah, they just have to start it by 2. Yep. Okay.
Excellent.
So Alani Lu is a 6-year-old from the Pacific Islands, and mum can't get any copies of previous vaccination records. So we now have to vaccinate her as if she's had nothing. Okay, this is what she gets. So for her age, she's still under 10. So she's under the 10-year-old section in the immunisation handbook. She needs 4 doses for her age of the DTP. So we're giving dose 1 as Infinrex IPV or Quadricel. Dose 2 and 3 will be 1 month apart, again as Infinrex IPV or Quadricel, and that way you're giving the polio as well. And dose 4 will be 6 months after dose 3, and that will be as Infinrex or Tripicel. Okay. So that's the DTP and the polio. Any questions about that? Hepatitis A is not applicable. Hepatitis B, again, she needs 3 doses. You're going to give dose 1 now, and then 1 month later you give dose 2, and then 3 months later you give dose 3. Use pediatric, either Engerix B or Hep B Vax 2, and whatever you use for the first one, you need to use for the 3 doses. She's 6, so she doesn't get any pneumococcal, no Prevnar 13. She doesn't need any Hib. She needs 1 dose of the Nimenrix or the meningococcal ACWY. In the handbook, it says if the child is over 12 months and has not received a dose, they are recommended to have a single dose of Nimenrix or Menquadfi. I've never heard of that, but anyhow. The MMR, she needs 2 doses. Give her now MMRV and get the chicken pox out of the way, and then a month later give her MMR. She's old enough to have the first dose as MMR. But there is a thing here about Pacific Islander people. There is a deficiency IFNAR1 one deficiency that you need to be very careful of, but you're not going to know if these kids have this. And anyone who actually has a measles injection and they have this, it can be very serious. If you go into the measles section of the immunisation handbook, there is this deficiency section, and it does say there's nothing you can do. You are still encouraged to give the MMR vaccine. But if maybe there is this deficiency in the family, you need to either go to an immunologist or the immunisation specialist clinic for advice before you actually give it. The child's too old for the rotavirus, and you've already given the MMRV.
Someone had needed 5 doses of DTPA as they were born after 2014.
No, it's how old they are at the time. If you go to the immunisation handbook and it has how many doses they are for their age, it'll show you.
Yeah, and we do have a link to that in the resources sheet,
yep.
that table. Does that answer your question, Leanne?
It doesn't go on the year.
Yeah,
it's their age at the time. Okay, and so this child also is recommended to have influenza, and again 2 doses because they're under 9, 1 month apart, but it is not free for this child because she's over 5. And the varicella, again, she's recommended to have a 2nd dose, but again, the 2nd dose is not for free.
And we do have another question on the varicella 2nd dose. How would you explain to parents why that 2nd dose is needed, but they've got to pay for it?
Because we don't have a huge amount of problems with chickenpox per se as they do overseas. Most countries actually give it for free overseas. Australia doesn't have such a huge problem with chickenpox. The reason it's given is to try and alleviate when they're older shingles. So if they don't get chickenpox, they won't get shingles. And shingles is a really huge health burden for older people. So it's not really going to affect them until they're older. So if we can avoid them getting chickenpox, then they won't get shingles and we won't have the health burden of shingles when they're older. And this is just a way, because we do know that 2 doses is better than 1. It's just not funded.
Yep. Excellent explanation. I didn't even know that myself, Anne. Thank you very much.
Okay.
Can an adult get chickenpox when they're older with these?
Yes, they can, but they're less likely to if they've had 2 doses of the vaccine. I mean, there is no vaccine that's 100%.
Yeah. Excellent.
Okay. No more questions?
Yep. Not at the present moment.
Okay.
Yep.
Okay, so we got Sandra Watts, who's a 31-year-old, and she's going to be a healthcare worker in a public hospital. She only has evidence of 3 doses of COVID. She's going to be a Category A worker working in ICU. So Category A worker is someone that is really close contact with patients. So they're the highest category and they need to be vaccinated for that reason. So here, because she has no evidence of any DTP, she needs to be vaccinated as if she hasn't had it. So for her age, if you go to the catch-up section in the handbook for the over 10s, it tells you how many doses they need for all these vaccines. So she does need 3 doses of DTP and 3 doses of polio. So because she's over 10, she now doesn't get Infanrix or Infanrix Hexa or any of those. She now gets Boostrix, IPV or Adacel polio. And mind you, these are not free for her. All these, except for the MMR, she has to pay for. Hepatitis A is not for her. Hepatitis B, she needs 3 doses, and she needs adult doses. Dose 1 now, dose 2 a month later, and dose 3 3 months later, and give the same for all doses, adult Hep B Vax 2 or Engerix B. And then you do serology 6 to 8 weeks later. None of that's for free. The MMR, so she needs to have evidence of 2 doses of MMR vaccine, or she can have a positive IgG serology for measles or mumps, for measles and mumps and rubella, or she can be born before 1966. She does not need to have any of that. Okay, if she does have the vaccines, they are for free. Anyone born before 1966 gets the MMR vaccine for free. And varicella, for her age, she needs 2 doses 1 month apart. It's a monovalent Varivax or Varilix, and can be given on the same days as the MMR or a month later. There needs to be a month between all live virus vaccines, and the MMR and the varicella are all live virus vaccines. You cannot use, for this age, over 14, you cannot use MMRV vaccine. So you can't give Priorix Tetra or Proquad to anyone over 14. So you can't use it for this. And you cannot for a healthcare worker, do an accelerated course of hepatitis B. Anyone else? Anyone questions?
None in the chat at the moment.
Okay. So she's expected to have an influenza vaccine every year. Before she actually starts her work, it's not for free for her, but once she's actually in her job, she will get it for free as a public healthcare worker. It is necessary for Category A staff. It is strongly recommended for Category B staff. So COVID doses for Category A staff, they need evidence of 3 doses. For Category B staff, they need 2 doses, and the 3rd dose is strongly recommended. And there's a TB assessment tool in the policy directive. They need to complete that and send it off for assessment. So the GP, nurse or pharmacist can complete the vaccination record card for this patient. She can't do it herself. Any questions for the healthcare worker?
This is just a comment saying needs advice on contraception if is sex active after varicella vaccination.
Or MMR. You can't,
MMR.
any live virus vaccine, you can't fall pregnant for a month afterwards. That's correct. What was I going to say? Oh, for other occupational health vaccinations in the Australian Immunisation Handbook, for in the section of occupation, there's all sorts of advice for different, early childhood workers, etc., etc. There's advice in there for all them. But usually it's not for free. So we'll go on to the next one, Kira. Yep. Okay, so Lance Groves. He's a 25-year-old man who had a car accident and became asplenic from that. It was checked, infant records and school records are all up to date. So he had all his infant and school vaccinations. So he was up to date with all that. And so this is what he's had. So he's had his DTP, He's had 3 doses. He's had 3 doses of polio. He's had 3 doses of Hep B. You don't need them for asplenia anyhow. Asplenia can cause you to catch a lot of bacteria. The body can't fight bacteria as well, especially for invasive pneumococcal and invasive meningococcal diseases. And Haemophilus influenza type B. So for Hib, he needs 1 dose. That's it, 1 dose of Act Hib. He doesn't need any further. For the pneumococcal, you give a Prevnar 13 now, and then 2 months later, give him another Prevnar 13. And then 5 years later, you give him a Pneumovax 23. And then no more of the pneumococcal. For pneumococcal, for Prevnar 13, that's the vaccine now that we're giving to all 70-year-olds. We don't give Pneumovax 23 to 65-year-olds routinely. It's just kept for asplenic or people with medical at-risk conditions. So for the meningococcal ACWY or the Nimenrix, you give a Nimenrix now and then 2 months later, and then a booster every 5 years. He's had his 2 MMR and he's had his 1 varicella. His influenza, he's more inclined to pick up influenza as an asplenic person, so he needs to have that annually, and that's free for him. And the Bexsero, you give it now, that's for the meningococcal B. You give that now, and then 2 months later, and then a booster every 5 years. And these are all in the Spleen Australia. Has anyone seen Spleen Australia? It's, hang on, sorry. So you go into clinicians' adult recommendations. So this is for over 18, it's an adult. And this is for someone who has not previously been vaccinated. Okay, so it's really easy to follow. This is for the pneumococcal. They have a Prevnar 13, and then 2 months later, sorry, I said another Prevnar 13, but it's actually a Pneumovax 23, and then 5 years later, another Pneumovax 23. The meningococcal, you've got Nimenrix, and then Nimenrix, and then Nimenrix, and Bexsero, 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 and Hib, and influenza. And then if they've had vaccine before, they've got other alternatives here. They're really, really good. This follows the Australian Immunisation Handbook. It's a really good resource to have. And then if you need someone with who's a paediatric, it's a little bit more complicated, but it's all here. Okay. So that's for anyone under 18. And asplenic people get all these vaccines for free. So for pneumococcal, if you're not too sure on who gets what for free, there's the Pneumo tool on the Immunisation Coalition. Use that. You put in the information and it tells you what pneumovax or pneumococcal vaccines people need. And also immunocompromised people. There's sections in the Australian Immunisation Handbook that will guide you as to who gets what. Other people can get certain vaccines for free, certain, and they're more likely to need both the Prevnar 13 and the Pneumovax 23.
And is there an upper age limit for the 70-year-old Pneumovax?
there's a catch up at the moment up to 79, from 71 to 79, and it finishes, that catch up finishes on the 31st of the 10th, 2023.
Was that for Pneumovax?
Oh,
or
no,
for...
that's a Zostavax, sorry.
Yeah.
Yeah, no. It's just 70, just 70-year-olds. Yeah.
Yeah, but if they missed it at 70, they can still have it. There's no upper age limit.
They say just 70, but you know, if they've missed it for a couple of years, just give it. But that it's not meant to be that way. Like, I can't say.
No, but I mean, obviously, yeah, they have to pay for it if they're over 70.
Yeah.
But do they still, you know, if they missed it and they're happy to pay for it, there's no upper age limit.
No.
Yep. The end date for the Zostavax catch-up is the October 2023. It's in the New South Wales NIP schedule. It's written in the little table.
So that's it. Anyone got any questions that I can finish? That's my email address.
I just wanted. Oh, sorry.
I just wanted to share something else. The pneumococcal in the schedule, it says pneumococcal funded for people aged 70.
That's what I was about to mention.
Yeah. 70 and over.
It's got it.
Yeah, sorry, 70 and over.
Catch-up available for 70
and over. Yep. Sorry.
And it's also available a catch-up's available for a 71 to 79-year-old until the 31st of the 10th, 2023.
No, that's
for Zoster.
Oh, is that what you're talking?
Yeah.
Oh, you're talking about pneumococcal.
Yep.
There's a question, where do we find updated information for travel vaccines? I guess the handbook would be.
Yeah, there is a travel section. Yep.
And we hope to do a travel vaccine webinar in the second half of this year.
Yeah.
But yeah, in the meantime.
There's a really good website called CDC. Just Google CDC Traveller Health, and it'll come up with this really great website where you put in the country that they're going, and it comes up with that country and all the WHO recommended vaccines that they will need for that country. And unfortunately, they're privately bought, so I have no jurisdiction over them.
Yeah, and yeah, as I said, we're going to organise a travel vaccine webinar in the second half of this year, so we'll get some updated information then as well. Thank you, Leanne. Anybody else have any last questions? Excellent. Well, thanks for everyone for attending this follow-up session. As always, if you've got any further questions, please call or email us at the PHN, or if it's a clinical question and you'd like to talk to the public health unit, please call them, or email is probably best. Anne, is that correct?
Yep. Email is better.
Yep. Excellent. All right. Thank you, everybody. We'll leave it there. Thanks, Anne.
Okay. See ya. Bye.
Bye.